Okay. All right. So today we're going to talk about issues that we see when we're in facilities and we're doing SQF or other GFSI pre-assessments or doing food safety risk assessments. And so the areas that we want to talk about today are food safety risk assessments and microbial hazards, environmental data management, supply chain management pitfalls, and then tying food safety culture, just a few slides, and talking about what we see in terms of management structure and behavior practices. So the first topic, food safety risk assessments and microbial hazards. Now, we've since, I guess, before COVID, done a lot of food safety risk assessments for very large international food companies that came to us and said, hey, we don't have the ability to assess our supply chain simply because we have hundreds of ingredients, we have hundreds of suppliers. Can you help us with that? And what we see when we go in those facilities is that most companies are using the FDA hazard guide. That's Appendix 1. And FDA has admitted, although reluctantly, that Appendix 1 may not be entirely accurate. And so they are working to revise that document. And so an independent hazard analysis based on scientific literature really may be a better basis for understanding what the true hazards are in those products. And that's because it's based on actual outbreaks and recalls. Sometimes with using Appendix 1, we see companies go down rabbit holes and try to chase microbial hazards that really aren't hazards, have a very, very low likelihood that they could occur, low probability that they could occur. And so we have to ask the question when we look at all of those microbial hazards that could be associated with a food or a raw material, is that pathogen actually a concern? And based on the probability and severity, we could actually eliminate some microbial hazards that may be listed because they simply do not represent a true hazard. Now, there's a lot of good documentation out there that you can use. I personally like the information in the ICMSF Book 7 because it allows you to look at specific hazards and group them, into, is it a severe hazard? Is it a serious hazard, but maybe has limited sequela? So there's some criteria that we can use to ask the question, if that pathogen has been known to be associated with an illness or outbreak, and is it a real risk? So it's very, very good information. And one of the things that I see is that companies tend to look at their microbial hazards exterior to their process, exterior to the intrinsic factors that are associated with that food, not considering the packaging system or storage or distribution, or what is the consumer going to do with that product. So all of these parameters can determine whether or not a hazard can actually occur. So we don't need to look at hazards in a vacuum. We need to look at hazards within the framework of our process and the distribution system and how the customer is going to use that product. That being said, FDA has a tendency of looking at hazards within through one lens, and that's in practicality not a good representation. So looking at some additional data is certainly the right thing to do. Now, when we talk about accurate assessment of risk, many companies, when we look at their food safety programs and we look at them within the parameters of the PCQI manual guidance information, they don't meet the requirements of the preventive controls rule. And the two areas that we see the greatest inconsistencies are environmental contamination, assessing the risk of environmental contamination, but also addressing pathogens in the inbound materials. And so we're going to talk about each of those areas independently. But when we start talking about environmental contamination, or we're talking about inbound materials, do all pathogens represent the same risk or the result in the same severity? And the answer is no. And so we have to look at this information, and we have to look at these pathogens in light of that information, because not all pathogens have the same probability of occurrence within a food system. And so then we have to ask the question, particularly in low moisture foods, are the presence of pathogens at extremely low levels always a concern? But again, we have to look at it within that food safety system. We have to look at it in considering dose response, in considering the intrinsic properties of the food or the raw material, and then what's ultimately going to be the impact on the food itself. When we do assessments of risk with supply chain, and I am going to talk about supply chain a little later specifically, but when we're identifying the hazards, I don't see overall the industry doing a good job of accurately identifying hazards from those materials throughout the supply chain. And it's because we're not necessarily considering the growth parameters of those organisms in reflection of the intrinsic factors of the food and how that food affects growth, and then ultimately how that raw material or ingredient is going to be used within the food system. We have to ask ourselves, what controls does the supplier have in place? Reviewing that third-party GFSI audit, how did they perform? What were the deficiencies? And as Leanne noted, have deficiencies been resolved through root cause analysis? And that's not just in environmental, that's not just in supply chain, that's throughout the food safety system. Are we resolving issues so that they don't reoccur by using root cause analysis? We see so many Band-Aid approaches to recurrent failures that we see. If you look at a large amount of data, we'll see recurring problems that may be attributable to the same root cause because they weren't dealt with initially, in a thorough way. So recurring failures is a big problem. Looking at third-party independent food safety assessments, what we hear from companies when they come to us and say, and it's not just Mérieux, there's a lot of companies that do this, but what they say to us is, we like having a new set of eyes. We like having someone come in and look and say, did we do a good job designing our program? And are we doing a good job executing and managing our program? And that allows us to look at overall what's going on inside that facility. GMPs and operational control, hazard analysis, now how hazards were arrived at and how risk categorization was made. Looking at CCPs and process preventive control validation documents. You'd be shocked how many companies will declare they have a lethality step, but there's no scientific validation to support that. And then what's the suitability of those process controls? Can it really achieve, the log reduction that they're looking at or that they need based on the regulatory requirements, and then based on what's coming in on the raw materials? And then that leads right into, have you assessed what's coming in the raw materials and the incoming ingredients? And so are those being controlled through supplier applied controls? See a lot of issues around EMP programs, including corrective actions and repeat issues. That leads right into environmental data management. So how are we managing our data? We see a lot of different types of programs. Everyone's kind of got their own, idea of what their environmental program should be. We see an overall lack of reaction to environmental indicator organism testing data. Not really trending to see, where's contamination coming from? Where can it be tracked through the facility? How do we prevent organisms from being tracked through the facility? And generally speaking, we see a lot of companies focusing on achieving acceptable results rather than identifying sources of contamination and then addressing those. Lack of understanding of what to test for in different zones, indicator organisms versus pathogens. And that discussion, we have to consider what's the risk to the product, but also what are the regulatory implications. And so having a comprehensive environmental risk assessment that takes into consideration the facility and the equipment design and the state of repair has a lot to do with how comprehensive our program needs to be. I've been in some facilities lately that were very old. I was in a dough facility and had a lot of environmental challenges. And so that requires a certain level of testing and a certain program. I've been in other facilities that are relatively new, facilities that are a year or two old. And so they don't have the environmental challenges that many of our older facilities have. So all of that needs to be taken into consideration when we're developing a program. So having that comprehensive environmental risk assessment to help guide that program is really important. And we generally speaking don't see that detailed of an environmental risk assessment. When we go into companies and we're working with them, companies do a pretty good job managing their CCPs. Maybe the documentation's not where it needs to be. Maybe the validation documents are not where it needs to be. But generally speaking, they do a pretty good job of managing CCPs. But the environmental concerns within the facility, the environmental program is where we see some of the greatest challenges. And the older the facility, the greater the challenges that we're going to have. If we do an environmental risk assessment, a very, very comprehensive environmental risk assessment, then it will answer all of the questions that need to be asked when we develop a program. We have a lot of companies that call us and say, we need you to tell us how many samples we need to take and what do we need to test for. And, it's very difficult to do that over the phone because we need to see the conditions in that facility. We need to see the level of operational control. Then we're better able to determine how many samples to take, what to test for, given the threat to the product, and then working with the companies to, establish a very good sampling and testing program. And then working with companies to do the data review and analysis. So many companies, we're not going to call out names, but we all know of companies that have had very large recalls because they didn't react to the data. They just got the lab report and filed it away, didn't use it as a management tool to drive improvement through the organization. And in setting up those programs, you need a very basic understanding of microorganisms and the relationships of microorganisms to each other. And why are you sampling? Regulatory compliance, trying to drive improvement. What's the motivation, customer requirements? How's that data going to be used in light of why we're doing sampling? and why we're doing testing and what we're testing for. How are we going to use that data? And then how does the program fit the needs of the company? What's the company trying to achieve? And then who's going to be making those judgment calls about data and corrective actions and what needs to happen and doing root cause analysis and driving improvement? Any program for environmental monitoring and control should be designed to identify growth niches. We want to prevent transient contamination from becoming resident contamination. So we have to assess the overall sanitary condition of the facility and the equipment. That's why we do a comprehensive risk assessment for the environment. What is the adequacy of the sanitation procedures? Are we finding entrapped material? Are we finding sites that could be a source of cross-contamination? Do we have hygienic zoning in place to prevent employees and to prevent material movement from becoming a source of contamination? Have we identified that absolute raw to cooked separation, or have we identified what's required to have lot and line separation? Many companies have well-designed, what you could call it high care areas or ready-to-eat areas, or those areas where products being handled that's already been decontaminated or received a lethality step. What's going on in those adjacent areas around that? What are the personnel practices that could be a threat to the product in those areas? And then, is equipment being maintained? Is it being maintained and repaired? Is it being repaired in a sanitary manner? Are there procedures in place to prevent contamination from those maintenance and repair activities? What are your processes to alert you that the process is out of control, even within the EEP program? So that's why it's important to have trending and to do that data analysis to understand what's going on in the process. Many companies that do not have a lethality step, but have microbial reduction strategies in place, have to be concerned with transient contamination becoming resident contamination. And that's where the thoroughness of sanitation practices comes into play. That's where understanding equipment and sanitary design principles and looking for entrapped material and growth niches. You can see here that this is a scratch in a stainless surface, and that transient contamination, as it moves across that surface, can become embedded in that scratch, in that piece of equipment, in that growth niche. And so how thorough of a job will cleaning and sanitizing do at removing that contamination? And so as product moves across those surfaces, if it is indeed a growth niche, then product can become contaminated from those microorganisms. And even if it's not a pathogen, if those colonies, those communities, microbial communities, slough off, it can have spoilage organisms. Even in the absence of pathogens, it can have spoilage organisms that reduce your shelf life dramatically. So understanding the seek and destroy concept, understanding how to identify growth niches and to evaluate sanitation practices, all of that should be a goal of your environmental program. So protecting the product, using all of those strategies that we can have in place to protect the product is really important. One of the things that I see overlooked in many plant assessments is that the facility doesn't recognize that there are requirements within preventive controls for evaluating the effectiveness of sanitation, verifying the effectiveness of sanitation. And these regulatory quotes are right out of the preventive controls rule, and you can see that it makes the statement all food contact surfaces, including utensils and food contact surfaces of equipment, must be cleaned as frequently as necessary to protect against allergen cross contact and against contamination of food. So companies aren't really addressing in their food safety program the sanitation of those surfaces where cross contact of product that has received a lethality treatment is possible. And so sometimes I think that we've kind of got a HACCP mindset where we think everything can be addressed in a prerequisite program. But within preventive controls, there's specific requirements of determining a preventive control for those sites where there could be either allergen cross contact or microbial cross contamination. And so establishing an acceptable level of testing to control contamination in the environment, but also as a verification of sanitation effectiveness is very important. And to address both of those issues, your program may look very different at times. So there may be some zone 1 testing for Listeria species, but there may also be some zone 1 testing for general indicator organisms to prove that sanitation is effective. So we need to focus on the comprehensive approach to our environmental control and identify growth niches, prevent the establishment of resident organisms, and also not ignore utensils and processing aids. So those things that may not be mainstream in our production process, but can be sources of contamination to the product, need to be controlled. I want to talk for just a few minutes about supply chain and some of the things that we see with supply chain programs and some of the inconsistencies that we commonly see. We see inconsistencies between the supply chain program and the microbial hazards listed in the hazard analysis. And many times the microbial hazards and laboratory results listed on the COA do not reflect the hazard analysis. We even see instances where, for example, I was working with a company several weeks ago. Their finished product testing was out of spec for coliforms, and they did not have a lethality step. So we started looking at COAs that came in the raw materials, and we found that the COAs listed coliforms at less than 10, but the finished product standard was less than 3. And so they were trying to figure out why coliform counts in finished product did meet their standard of less than 3. And it was because there were coliforms coming in the raw materials that were simply getting passed through. So not only do the COAs not reflect what needs to occur so that the finished product meets specification, but we also see that in many times raw material and ingredient companies are not using statistically valid sampling plans. And so the testing that is occurring is not necessarily reflective of what's actually happening within the lot. And understanding the relationship between the indicator organisms that are being used to determine raw material and ingredient effectiveness may not translate over to the concerns of the finished product. An example could be looking at spore formers in dry materials. So there's a relationship between mesophilic aerobic spores and bacillus species, but there are other organisms that can show up that might not necessarily be related to bacillus if we test for mesophilic aerobic spore formers. What's the relationship between Listeria species and Listeria mono? And we don't have a good indicator other than Listeria species. There's no good indicator for Listeria organisms. A common misunderstanding that we see is coliforms versus E. coli versus Enterobacteriaceae. And you can see that coliforms are a subgroup within Enterobacteriaceae. So as we design testing programs, what is it that we're actually trying to achieve? Are we trying to achieve an indicator for pathogen presence, or are we simply using coliforms as an indicator of process control? Regardless of what we're using, we need to understand the relationship of the indicator or the index organism to the increased likelihood of a pathogen being present. So if I have an Enterobacteriaceae count, what does that mean for the raw material or ingredient? What is that going to mean for my finished product? So the higher the level of the indicator or the index organism means that there's a greater probability of that enteric pathogen being present if we're using Enterobacteriaceae as our index organism. So we have to understand those relationships as we build our supplier approval and our supplier monitoring programs to make sure that we're testing for the right organism given what we're trying to achieve. Now, I want to speak just a minute to some of my observations with food safety culture. It's very common for companies to say, you know, can you look at my food safety culture program and tell me what you think? Well, what I myself have started doing is, as I'm performing a food safety risk assessment, I start looking for indicators of how food safety culture has been developed and implemented within that particular facility. You know, we tend to have a program mindset because we have to have something to audit, right? And I think we all understand that. But we went through the same issue back in the late 80s and 90s when we started working with total quality management. We started looking at tools rather than mindset. And so I think that we need to begin to focus on building a culture of food safety by considering the impact on food safety of the decisions that we make. And we need to develop our culture such that when we make decisions, food safety is considered automatically rather than relying on a set of programs or procedures. And if you read Deming's book, Out of the Crisis, which is his thoughts on quality management and managing for quality, we can use the same mindset in managing for food safety culture. Deming said that it should be part of our decision making. It should be automatic, that when we make decisions, we're making them with quality in mind, but now let's make them with food safety in mind. And I love this quote of Deming. He said, if you can't describe what you're doing as a process, you don't know what you're doing. And I think that really hits home to what we're trying to achieve with food safety culture. And I do want to, point you towards that paper that was published by GFSI on food safety culture. It's a starting point, but I don't think it's where we ultimately want to end up, because we want to end up where our mindset governs our behavior rather than trying to enforce a set of behavioral standards that can be somewhat subjective. With that, I'm going to stop sharing, and John will take questions.
Great. Thanks so much, Jeff. We do have a couple of questions that have come in for you. The first, when our supplier is asking what is a valuable reference for them to understand, test to find it for their EMP, a training for staff?
Um, that's a good question. I really think that um, we do need to do more training around EMP and around supply chain management, so that we need to understand all the factors that come into play when we're trying to develop those programs, and we're trying to develop that mindset.
Excellent. Our next question. I have often seen that you must have so many swabs dependent upon square footage. What would your response be if you didn't meet the requirements?
My response would be, let me see your environmental risk assessment. Because I've been in some very large new facilities where the number of swabs in those generic guidelines, and it seems like every association for each commodity has one, may not necessarily apply because of the age and the construction of the facility, and how well the process is being managed and how well the facilities are being managed.
Right. Next question. In a dry facility, can ATP used for environmental monitoring on food contact surfaces after a wash, or would that fall under sanitation rather than EM? Zones 2 through 4 are swabbed for EB, Salmonella, Listeria, depending upon location, but no food contact surfaces are swabbed for any of the 3 listed.
Okay, so first of all, I'm a big fan of ATP. Okay, so I think ATP is a great tool to determine whether or not the cleaning has been effective. Have we removed that organic matter? The challenge comes in dry facilities where there may be dust. What are we actually measuring? So I think the answer to the question is, it depends on the facility, how well dust is being controlled. I don't necessarily think that ATP is a good indicator for zones 2 through 4. Just realistically speaking, there's going to be more organic matter there in those zones. And so it's not going to give you a good representation of what's the true risk from a microbial standpoint, because you're going to be picking up a lot of product debris and residue.
Excellent. A similar question to one before about swabs per square foot. Does the FDA have a requirement for the number of swabs per area?
No, they do not. The only requirement that they have is that, based on your risk assessment, and as you go through the process of identifying hazards from your flow chart, doing your hazard analysis, that you identify those sites where cross-contamination could occur, and that those sites are included as a preventive control if it meets the preventive control criteria.
Very good. Next question. Do I have to swab for salmonella for a wet facility?
It depends upon a lot of factors. Is it truly a ready-to-eat facility? Is there a lethality step? What organisms are being brought through in the raw materials and ingredients? I'm not a big advocate of doing salmonella testing, because I think Enterobacteriaceae, even on non-product contact sites, is a much better indicator of how well we're controlling the environment.
Makes sense. All right. The questions keep rolling in. So the next one, does the FDA required to swab food contact zone for a non-ready to eat?
Boy, now that's a good question. The answer is, it depends.
It
I'm
depends.
sure most of you guys know that FDA has been taking a look at products that are ready to cook and not necessarily labeled ready to eat. And then they are declaring that they need to be treated as ready to eat, because the consumer can confuse ready to cook with ready to eat. And so that whole discussion has to be had in making the decision as to whether or not to do zone 1s for ready to cook products that are not labeled ready to eat. And so I think the agency is taking us down a really weird path that we haven't completely figured out in how they're treating that.
Okay. Another question, would you recommend salmonella and listeria testing on powdered ingredients that do not have a kill step at the supplier?
If it depends on how the raw material is going to be used, and this is a huge disconnect that we have, because I can't tell you, I mean, I hear this literally in every facility that I go in, that we can't get our raw material and ingredient suppliers on board with what we need. We've never had a problem. We don't expect to have a problem. I mean, I hear all of the excuses. It depends on what you're going to do with that material. If it's a pass-through operation, if you're buying a powdered material that you're going to pass through and not process it, and you've identified salmonella as a risk, then you have two options. One is supplier does the testing and gives you a COA, or you quarantine that product and do lot sampling and testing before you release it to be used.
Excellent. Next question, they're asking for what are some of the basic steps in conducting a sanitation risk assessment?
So there's a couple of things. The first thing I think is really important is the condition of the facility. You know, are the floors degrading? In other words, is the aggregate showing? Are there cracks in the floors? Are there gaps in the wall floor junction? Is there condensate? Is there condensate not only on the ceiling, but on the cooling unit? So what risk could come from the actual facility? And then in that ready to eat or high care area, what's happening adjacent to that particular room? You know, do you have interventions in place that prevent the movement of pathogens from non ready to eat areas to ready to eat areas? And then how old is your equipment? You know, we've got equipment we've been using. You go into some of these flour mills, they're 100 years old. You know, they're not stainless. They have places where there's product entrapment. But I don't want to lead you down the path of what's got to be new. No, I've seen some slicers from the 40s that were easier to clean than new slicers. You know, so you have to look at every single factor and then determine what risk does that represent to the product and to the process.
Right. Again, going back to my conversation with Leanne, it's all about managing the risk.
It's about managing the risk. Absolutely.
Excellent. Now, this last question appears to be more of a comment. I'm going to read it, and maybe you have some insights, or you can further comment on what they have to say. Environmental monitoring, except for water and compressed air, not required for low risk. Our risk assessment based on dry process, therefore, environmental monitoring not required. Not quite sure what they're getting at, so thought you might have some more insights.
I think that it goes back to doing that comprehensive environmental risk assessment to determine whether or not there are some real risk. And I'll give you an example. Years ago, pre-COVID, I was doing an ingredients assessment on a product that did not support growth. And it did have a kill step. There was no environmental program in place, but when I got to the end of the process, because the customer was like, well, I don't know why you're here, we're low risk. And I got to the end of the line and they were filling 5-gallon pails, and there was a person washing the floor and the water was splashing off the floor right into the top of the 5-gallon pails. That just went from low risk to high risk. No, pathogens can't grow, but they can exist. And if that material is just in a pass-through operation without a kill step, then there's a microbial risk in that product.
Gotcha. All right. One more question. Is temperature control required in a food manufacturing facility? I think I know the answer to this one, but I'll let you take it.
Depends on the agency. Mm-hmm. Depends on the product. Okay. So USDA would say that your rooms have to be less than 50 or you have to do a mid-shift wash down. FDA, it's dependent on the nature of the product.
Okay, great. Jeff, thank you so very much. Lots of great questions that came in, and we appreciate all of your insights.